Good morning. Welcome to our sessions of the futures of thread lifting. Where does it fit in our modern aesthetic practice? As you may know, the thread now is quite popular for quite a long time already. And how to approach and to perform it properly is one thing. So I will co-share with Dr. Poliva Irene
Yes,
from
thank
Italy.
you. It's a real honor for me to be with you here and to co-share. And it's my pleasure to invite our first speaker, Dr. Desai Viral Ramesh. Is it correct, Dr. Ramesh? Fantastic. He will be speaking about combined jawline definition and double chin definition with liposuction and thread lift in one procedure. Extreme.
Thank you so
Please.
much. Thank you so much, chairpersons, for the kind introduction. Always a pleasure being here at IMCAS Asia. So yes, I am talking about something which is partly surgical and how a minimally invasive or thread lift has changed my practice over the last 6 to 7 years since I've been doing this. Now I'm a plastic surgeon practicing for the last 24 years. I have been doing thread lift for 24 years now, using different kind of threads which have come and gone in the market. Okay, now what makes a great jawline? Symmetrical, angular, well-defined contours, perfect or proper amount of fat. You can't have no fat, proper amount of fat, healthy, non-sagging skin, and that gives a perfect jawline. What will give the submental fullness, which is so common in where I practice in India, and I think all over the world, genetics is one factor, weight gain, and of course, old age. So now think of it as a comprehensive structure. You cannot deal only with one and expect great results. Foundation of a jawline is by the bone, which is of course your mandible, the horizontal and the vertical ramus. The contour is with the muscle, which is your masseters, digastrix, platysma, and mentalis. More important, masseter and platysma. Refinement. So deal with the foundation, then you think of the contour, and then you refine with the soft tissue, which is your fat and your skin. So if you follow this order, you will get it right every single time. If you have a weak mandible, you can't expect to have a good refinement, and vice versa. So you think about it starting with this, okay? So of course, the foundation. There are different kind of chin, short, square, round, long, receding, protruding. And of course, we know about the dimensions of the chin. What about the anatomy of the platysma? Basically, a large muscle, thin muscle, which arises from the clavicles across the neck, goes into the jawline. It actually fades into the smash. It actually goes into the face and just joins with the smash. What about the fat here? Okay, the fat is, everybody thinks that fat is above the muscle in most of the cases. That's not true. It is above the platysma, it is between the muscles, and it is deep to the platysmal muscles, superficial to the deep muscles like the digastric and the submandibular gland. So if you're talking about supraplatysmal fat, it is mainly two components, suprahyoid and infrahyoid, okay? This is easy to deal with either by minor liposuction, or you can even probably do lipolysis, HIFU, many modalities, okay? Subplatysmal fat, basically between the platysma and the submental musculature. It is the central suprahyoid between the hyoid and mandible, central infrahyoid, lateral infrahyoid compartments on each side and between the digastric and mandible at the submandibular glands. This is difficult to deal with without surgery or without some kind of a minimally invasive procedure. This is often missed. And yes, deep neck fat can only be dealt with a proper neck lift where you actually excise this part of the fat. And it is deep, located deep to the submandibular gland and submandibular musculature. So always remember these three layers if you want a proper contouring. Now, how do you plan it? If you have a bony defect, either if you have a protruding chin or a retruded, you have to think about a genioplasty or a chin implant or something similar. What about the muscle? You can relax the muscle, reduce it with botulinum toxin. You can perform a platysmoplasty, subplatysmal fat resection. In facelifts and neck lift, we actually do digastric and submandibular gland retraction, which has actually protruded or which is actually prolapse. So we actually get prolapse of the submandibular gland with age, and we actually remove the superficial part of the gland in order to give good contour. And refinement, like I said, with HIFU, with lipolysis injection, or with liposuction and so many other modalities like freezing and etc., which have come into the picture. So genioplasty, chin implant, all very simple surgery to do. Again, where we practice in India, it's often we have retruded chins rather than protruding chins. So we perform this quite often. I prefer the intraoral approach simply because there is no visible scars. Okay, many people like the outside approach. I prefer the intraoral. Most of the patients tolerated well with local anesthesia. Some who are sensitive, we may have to, here you can see it's under local. There's no tube, nothing, it's just under local. Gently lift up the mucosa, use electrocortic dissection, lift up the muscle. The dissection takes 15-20 minutes to perform. And when you place your chin implant, you may even modify it. You have short chin implants, long, you have various kind of chin implants, and the results are always very, very good. A word of caution, the implant tends to migrate. So always take a stitch or fix it with a screw so that it will not move then in the future, okay? The other thing is, of course, the submental liposuction. Now, what do you do in that, okay? The first step is infiltration, okay? The first step is infiltration. Sorry, I think the wrong video played first. Yeah. The first step is infiltration. Use enough, always use hypertumescent solution, okay? Do not compromise there. Use adrenaline, adequate dose. Wait. This is again performed under local anesthesia. You can see there's no tube. Most of the time tolerated well. It's barely a 2 millimeter puncture. You can actually get rid of the fat easily. Pre-tunneling to make sure that you break the fat. You may use Vaser, you may use RF, you may use some kind of technology to do it. But in the submental region, because the nerves are very delicate, the vessels are delicate, I don't prefer power in this area because it's too aggressive. It's a very delicate area. So I don't use power assisted at this stage. And gradually you, see this is the second video, the one played now. Sorry about the sequence. That's the pre-tunneling. Never start sucking immediately. Make sure you're in the right plane. Get the pre-tunneling done and then you start your suction, okay? So it's a fairly easy procedure to perform. And important, check for symmetry, okay? Check for any lumps, check for nodules. You may even put some saline on it and see for the reflection, okay? Always roll out the skin in your hand. Check very, very carefully to see whether any lump or the evenness, the skin has to become very, very thin. It has to, you have to pinch it. You should get absolutely nothing, no fat in your hand in this area, okay? So do that. If you do find any kind of small lumps, you can see that lump very, very clearly, okay? So make sure that you deal with it. You can take a small incision just in front of or behind the ear. It's a 2 millimeter incision. It's not going to be visible at all, okay? Here I can see this small lump here. So I will take care. The cannula I prefer is the classical Mercedes or the single hole design cannulas in most of the cases for submental area. So I just hold it and make sure it's thinned out. Here you can see another lump there, okay? So make sure of the symmetry. Do take time at this step because this is very crucial. If you leave any fat behind, it's going to show because it's a very small area, okay? Combine this with the lower face liposuction, only then will you get a proper jawline. So don't only deal with submental, deal with the jowl fat. Now coming to the threads, what happens to the skin? Obviously, if you deflated the skin with age, with decollegiate skin, you may get some sagging because there is inadequate anchoring. So I use the threads which are from Aptos. These are called the double needle threads. They are bidirectional with central clear area. Okay, they are material made of PLLA with PCL. PLLA for the collagen stimulation like Sculptra and PCL for longevity and flexibility. They are on a needle, double needle, okay, and they're 50 centimeter long. The procedure is quite interesting. We call it a hammock technique, hammock. So you mark from behind the ear, you go through the platysmo-auricular ligament. Through the platysmo-auricular ligament, a single needle prick with a 16 or 18 gauge needle, insert both the needles together, okay? As you go inside, you start diverging. So you go convergent, then you go divergent, both needles together. This is local anesthesia infiltration. Just a little bit. You can see both needles together. You just take them around a centimeter and half apart. The needles are sharp at both ends. So why you would say, can I do this with any other thread? Probably not. These particular threads have the needle sharp on both the ends. So you can actually turn the needle inside and you can, pierce it. You are not supposed to exit at all. You come towards the midline. As you come, okay, what I've done here is I've just simply turned the needle without exiting at all. So the thread does not get exposed, okay? And you similarly reach the other side and again don't exit out. So you start convergent, go divergent, and then again converge, okay? Again converge, go as far as possible to get maximum anchoring and then mold it, okay? Yeah, this probably is a little more slower motion of it. So making the puncture, giving a little of local anesthesia, yes, that's the puncture. So I'm going with both my needles together. I'm going through the platysmo-auricular ligament, which is where I get the anchoring of the threads. If I do not go through a ligament, I will not get adequate anchoring. Okay? Both needles together. Once I insert for an inch, then I separate the needles out, going towards the midline, one by one. Here. So one needle is just below the jawline, where I proceed further. Okay. The other side. This is the important part. Here. The other side. So the distance between both of them is around 1 to 1.5 centimeter. Okay. In order to get a proper, perfect jawline. Now watch this step. This is important. I reach till the tip. I do not exit. Sorry, my glove came in the way. I turn in the tissue. So it's just barely 5 millimeters inside. I literally turn in the tissue. Okay. And then I proceed in the center, this portion, in order to tuck this portion in, the submental portion where I want maximum results. I do the same with the other needle, okay, the other needles, other side. This is actually doing it in the operation theater, okay, same. I'm just going to skip this. So yeah, so as we saw, so it creates a hammock effect. This is like a hammock. And the double barbs, one side pulls it this way, one side pulls it this way and tucks it in. So this is why you can only do it because both sides are sharp. If I have one side sharp, one side blunt, I will not be able to perform this turning step and exit carefully. Often nowadays, from last 3 years, I've been combining this either with the 1470 diode, like the popular Endolift, or there's so many machines, or the body tight or neck tight. Okay, I've been combining. So I am actually creating tightening at various levels. The fibroseptal network is actually getting anchored very well, putting in the threads and getting anchoring. With this, I'm getting much better long-term results, okay? Some of the results which you can see out here, okay? I think I have just a minute more to go. Like I said, do not forget about the submandibular gland. Do not forget about the platysma. If you have to resect it partly under local also, it's possible. You may consider lipolysis if there's too much of fat, but of course, if you're doing suctioning, you don't need to do that. Sometimes when I do suctioning of the lower face with the jawline, I would just perform some lipolysis just above that in order to give a smoother contour. Okay. So I would get a smoother contour. So certain areas which I can't get or are dangerous with my cannula, there I would think about putting some of the DCA, deoxycholate. That's my product of choice, which I like. I think it gives better result than PPC or lemon bottle. So this is what I do, and typically we all know about it. 0.1, 0.2 ml in a grid fashion, very easy to do. Just be careful of the nerves and don't be too close to the skin in order to prevent any kind of damage. Very easy procedure, okay? Platysimal bands, resect them. You can even cut them or inject them with toxin. If you have a large muscle masseter, of course, think about giving toxin there, 30 to 50 units each side. We know that. With this, I'd also like to invite all of you all to come to Goa for a conference, Global Aesthetic Summit. We have a conference in collaboration also with IMCAS, a lot of workshops, a lot of hands-on, and so many other things. Thank you so much. Thank you. Thank you.
Thank you. Viral, fantastic lecture. Now we'll move on to our next speaker, Dr. Rosaline Kupiwat. She's my beloved junior. She's from Mahidol, Sirilat. Just graduated her PhD in dermatology. So her topics is PDO thread-based dynamic support, a novel concept to prevent overfill syndrome and enhance facial lifting outcome. So please welcome Dr. Rosaline.
Thank you for just a warm introduction, Kajan. I'm gonna need a stand because I'm just too short. I want to be able to look at you guys. So yes, as Ajahn already introduced me, I'm Dr. Rosaline Kupiwat. I'm a dermatologic surgeon from Bangkok, Thailand. And first of all, I'm the global speaker of the Diamond Biotechnology, and the products that I use in this presentation is actually from Diamond Biotech. So first thing first, when we talk about facial laxity, there are so many factors that induce the facial laxity. Well, one of the main key component is the fat distribution, especially the superficial fat pad that droops down due to the gravity, due to the loss of the supporting structures. As you can see from this diagram, those supporting structures lose its function, lose its strength. The facial ligaments lose its support. So that's why the superficial fat pad droops down. And you can also go have a look in this published study. There's a theory called the fat compartment gliding theory. It's pretty much the same thing that I already explained. And by fixing this, we can use thread lifting in order to reposition those drooping fat pad to get it back to its original place. So this diagram shows once you insert the thread into the subcutaneous tissue, you can actually reposition it vertically or horizontally. It depends on your design. But however, when we talk about thread lifting, the conventional thread lifting usually composed of a single vectors. It's pretty much just one vector according to each thread that you plan. It is pretty good, but the problem is that it is pretty much about tissue reposition than regeneration. The lift is there, yes, but sometimes you can see that the patient doesn't have that much of a natural dynamic movement. That's the main problem that we see a lot of times, and I think that's one of the reasons that thread lifting had lost its popularity during the day and up to the present. And also the downtime and the complication rates. It's pretty much operator dependent. You can see like some patient, they went to have a treatment with a doctor who's not that experienced, and they come up with like quite a lot of complications. There is this study. They include all the patients in China, like from year 2014 to 2020. According to this literature, there are 190 patients with complication from the conventional thread lifting. The most common complication include the skin dimple, include the contour irregularity, and can be up to like a really severe one like hematoma or even facial paralysis from the nerve palsy. As you can see, the more complex, the more complicated technique you use, the higher rates of the complication that there will be. Of course, if you are good, like you're like an experienced doctor, of course the result is going to be good. But if you're new to the technique, you're new to the material, a lot of times it can cause the complications. And as I mentioned, like one of the worst complications from thread lifting is actually facial palsy, and sometimes it can be permanently damaged. So I come up with the new concept of the cross-tension support. Instead of using large thread, I started to cooperate with the smaller thread, much smaller, in order to reduce the complication rates. And when you use a small caliber thread, you can actually insert it more superficially without, you don't have to worry about getting skin dimple or getting a contour irregularities because the size of the thread is pretty much small. But because it's small, you can need quite a few number of threads. But this is a good thing because the crisscross thread itself actually acts in many mechanisms. It acts like a scaffold matrix for regeneration. It's also have this overlapping zone, which I will discuss further. So basically, it's pretty much more simple procedures to do. If you're new to the procedures, you can start it easily. You can reproduce it pretty much easily, and it's pretty much safe. So the biomechanic behind this technique, I would say there are three main mechanisms: stimulation, strengthening, and remodeling. Stimulation, as we all know, all the PDO threads, there are so many studies support that around the thread, once we insert into the tissue, it will create this form of the collagen bundles around the threads. And in some study, the collagen bundle can last up until 12 months after insertion. However, if we add, that's only PDO, that's the main, the plain thread. But if we add some kind of barb interaction with the tissue, that's going to induce more collagen productions because the barb itself acts as a localized mechanotransduction. It can induce a TGF-beta, it can induce the SMAD pathway, and also induce more and more collagen production. It is confirmed by this study. This is a really good study. They insert the thread into the mouse, and they found that the side with the barb has 3 times greater collagen productions than the side with non-barbed thread. And second mechanism is a strengthening. As I mentioned, the overlapping, the design, if you remember, is going to be like a mesh design, like a crisscross design. As you can see from this section from this paper, the crisscross side can actually stimulate more intense, I call it a mechanical stress node. It's 5 times more higher the collagen production than just a normal perpendicular kind of insertion. So yes, if you are crisscrossing the PDO threads, you enhance the effect of the collagen productions by 5 times more. And also not just that, let's go back to high school, let's go back to physics. So if you have just one single vector lifting, you have higher strain per threads, per one thread. But if you use like a crisscross pattern, the force dissipated. So you end up with a lower tension per threads, you end up with a more even and more stable lift, and you enhance the longevity of the thread and reduce the risk of the complication and reduce the risk of deformation of the threads. Lastly is the dynamic remodeling, because we insert it as a mesh form, as like a crisscross pattern. So this grid function acts as a scaffold. So it's maintain the support, it also allows a motion, and it's become like a structure where once the collagen bundle will form, they can have some place that they can connect to and form into more proper structures, more strengthening structures. There are also some study that published about the crisscrossing pattern. I'm not saying that I come up with a new invention, it's already been there, but they use a mono threads. Okay, as I mentioned, if you want more collagen productions, maybe I would prefer barb thread. But then again, you're gonna need a barb thread that is small enough. So for me personally, I use this baby thread from Meteora by Diamond Biotech. As you can see, the thread size is like 3 to 4 times smaller than the normal thread size. So that's why it can have lesser complication. So I have a case. This is a 30 years old female patient. She's concerned about her jawline, her submental, her nasolabial fold, and also a little bit of Marriott line. So this is my treatment plan. So the plane of the placement, I put it superficial subdermal plane or the superficial subcutaneous plane. And design, the first entry point, I use the highest point of the arch of the eyebrows to the hairline. So the entry point is going to be on the hairline. Super easy, super simple. The second entry point is going to be on the lateral canthus to the hairline. That's your second entry point. And you can draw a line accordingly. So there's going to be one side with a vertical kind of vectors and another side with the horizontal vectors, and it's crisscrossed to each other. Pretty much easy to remember, right? And so basically you use around 10 threads per one side. This is how I do the procedures. And this is before and after, one-sided treated. As you can see, because the thread size is super, super small, so the trauma to the tissue is much less. So you don't get that much of a swelling effect. Like if you compare it to the conventional threads after the thread lifting, like your patient have a really swollen kind of face, or sometimes if it's the tension is too much, you get like alien kind of face, which sometimes, I mean, like it's good for a long-term lifting, but most of my patient doesn't want to bear with like that kind of too much lifting kind of face for a couple of weeks. So this is like more natural and more refined results and then immediately. And this is two-sided immediately after the treatment. You can see that a lot of people ask me, if it's too small, will the lifting effect will be there? I would say that it depends on the product that you choose. But if you choose a product that has a good design of the barb, you get quite a good anchoring effects. So once you have a good anchoring effects, you can actually still get the lifting while preserving the small size of the caliber. And this is 1 month follow-up. As you can see, the swelling is not that much. It's not that much of a difference from the 1 month follow-up. And you can appreciate her jawline, her nasolabial fold, and her Marriott line looks good, and she looks pretty much very natural. It doesn't look like she had a thread lifting done, actually. So as you can see, her jawline gets much, much, much better. And if you take a close look, maybe it's not so obvious on the screen here, but her skin quality also gets better. I use the Observe Machine 360, and you can see that I think you can see, yes, the texture of her pores, of her skin gets better. This is after 1 month after the treatment, because we know that PDO is also one of the biostimulators, so it can actually stimulate those collagen production and helps with the skin texture. Is also from Observe. I also use Antera to visualize better in terms of texture, and the results shows like really significantly better in terms of the texture improvement. I also use Cutometer in this case. She's a friend of mine, so I can use so many machines on her, lucky me. So the Cutometer also found that her skin has better elasticity after 1 month. I mean, I didn't follow up her for that long, but you can see like the effect of this kind of treatment. So just to wrap up everything I said, I personally, I've been doing thread lifting for quite some time, and because I see a lot of complications, referring cases and everything. So I think if you are new to thread lifting and you want to start trying to use the procedures like thread lifting, maybe cross-tension support would be one of the better options, because it can give you 3 main mechanisms: stimulation, strengthening, remodeling. And it is pretty much safe, pretty much simple, reproducible, and it enhances both structural lift and also you get the good skin quality. Thank you very much.
Thank you, Dr. Rosalind, for this excellent presentation and impressive result. And now it's my pleasure to invite my friend, Dr. Egan Cyril Mitchell, to talk about thread lifting in transgender patients. He's a very popular doctor for this procedure, and I think he is one of the best in the world. Please, doctor.
Thank you. Thank you for that wonderful introduction. It's a pleasure. And Dr. Irina as well. We are both one of the best in the world. And Dr. of course, Paisal, our mentors and our idol in this industry. But thank you for having me. So when I first submitted this topic, I said, because Thailand is for me one of the most LGBT-friendly countries. And I said, it would be nice to talk about the transgender population here in Thailand. But one thing I didn't realize is IMCAS in Bangkok is June, which is the LGBT Pride Month. So happy to be presenting here. And actually, one of the reasons why I became popular, I will tell you, because I was doing presentations on drag queen transformations all over the world. Did you know this lecture of mine has been to 9 countries? And it was one of the most requested topics from me, and which I also presented in Kolkita, which will also have Kolkita Congress in 2 weeks' time. So I hope some of you will be able to attend that. But anyway, I just wanted to, because now I'm talking about transgender patients, and just to clarify, because for a time people were confused that they thought that drag queens are transgender as well. So not all drag queens are transgender, because drag queens usually they do makeup, but during the day they're normal like male people. But transgender, they have a different gender identity, meaning they feel a different gender, different from the ones that they were born with. That's why you have trans women and trans men. So trans women were born male, but growing up they associate themselves as a female. That's why they became females. Now, transgender patients, they're marginalized. In the Philippines as well, growing up, they don't get a lot of opportunities because of discrimination. So they end up being in the parlor, they don't have good job opportunities. So usually they end up being poor. And for them to transform to become women, they really need a lot of stuff done, and as well as hormones, and they would just get their medicines from the black market. So meaning these are not FDA-approved products. They would tend to go do cosmetic procedures in illegal clinics from non-doctors, and that's why they become victims of disfigurement and overfilling. And it's really very sad. I see many transgender women and patients who look like this, overfilled and and injected with silicone oil in their faces. So anyway, going back to when you receive these patients, my goal always is, the goal is to make them look more feminine, right? So we want to hyper-feminize them because their features are very masculine. Of course, they're taking hormones to make their body system more feminine. So for me, in my clinic, my goal is, number 1, to make their faces slimmer, more V-shape and heart-shape. I want to highlight feminine features: cheekbones, lips, rounded forehead, okay, chin, a more feminine nose, slimmer and elevated. So during interview and assessment, I asked their goals. When did they transition? Are you on hormone therapy? Any past procedures? So this is very important. What have you been doing in the past? Now, even though you can see there's something going on in their faces, you just really have to ask, and really ask, because it will affect how you're going to treat them, okay? And then you plan your treatment, okay? So if there is anything that you can correct from the previous works that's been done, then do so, because it's hard to work on something that has a lot of things going on, right? But I never turn down patients, even if it's very challenging, even if they have a lot of silicone oil in their face. I will always try my best, especially for those who cannot afford to do surgery, all right? So these are the most common procedures that I do. Of course, toxin for that snatch look, masseter to make their face slimmer. Fillers, I use it again, it's good to project feminine features such as cheekbones, forehead, chin, lips. However, we have to be careful, because in our attempt to hyper-feminize, we would tend to put more products, and then we fall into the trap of being overfilled as well as unnatural looks. So we have to be careful. And that's why, thread lift has become a good alternative to fillers, because when you insert it in the cheeks, you're able to reposition and create volume without overfilling because there's no additional volume. And I'll show you how I do it, right? So these are two patients examples that I want to show you because these are as well friends that have become really good friends in our clinic. So Xtina Superstar. So Christina, but she calls her Xtina. She's actually a renowned DJ in the Philippines. She's a brand, celebrity brand events, and she's a fashionista. She's also a model, but she organizes events for LGBT. Now, when she came to the clinic, she had wrinkles, of course, under eyes. She wants to make her face smaller, improve the profile. So this is how she looked before. So at first, I was just doing filler toxin injectables, and then eventually I said, so as you can see, we've transformed it. We've made the wrinkles very smooth. We've created a nice shape for her face. And then eventually I said, you know what, because of the nasolabial line, if I put too much filler, then it's gonna not look very natural. So eventually, before that, of course, for me, I love doing jawlines, whether women, female, or male. Having a nice jawline really makes the face beautiful. So just improving the jawline there. As you can see as well, projection of the chin. And then I did the threads. So I did a similar cross-hatching, but this time I'm doing two entry points, one by the mid-cheek projection as well as the in front of the tragus. So these two, you would see towards the lower part of the face, they're crisscrossing. So I do agree that it does increase the fixation and the hold in the tissue. So this technique would then slim the lower face and then create more volume upwards. Now, if you saw as well, now I would only do these 2 points for patients with longer faces, because if you have a patient with a short, round face, it might make their face look wider, all right? So the product that I use is a multi-directional barb thread. Okay, so multi-directional barb thread really provides superior fixation. Now, these threads are 2O, so they're very thin. Again, I'm not afraid of them being visible under the skin. They're also white or colorless, so you don't really see it. The composition of the thread that I use is PCL-PLLA with HA. So PCL-PLLA in itself already lasts you for almost 2 years, so I like the longevity. These are also biostimulatory components, which would add to the tissue regeneration and improvement of skin quality over time. Now, this particular thread as well is, and probably the only one that I know, that they embedded the thread with hyaluronic acid, okay? Now, this hyaluronic acid is not just an ordinary hyaluronic acid, it's a timed release HA. So while the thread is embedded under the skin, it slowly releases HA. And we know what HA does to the skin. So you just have like an internal skin booster going on as the thread is inserted. So again, you have superior fixation, tissue repositioning, biostimulation over time, and at the same time, the duration of almost 2 years. So that's why this is my favorite. It's loaded inside the blood tip cannula, so in terms of tissue trauma, much less. Consistency in layer implantation is also much, much better. And the threads are meant to be implanted in the superficial subcutaneous plane. Now let's talk about that plane very quickly. So superficial fat is thick in the mid-face and thinner in the lower face. I always believe that superficial fat has sublayers. So my goal is to be able to insert it exactly in the middle of that thickness. Because the closer you are to the skin, yes, the lift will be more effective, but the more chances of getting dimples. The deeper you are, then the more chances of not getting as much lift and also hitting structures that we don't want to hit, all right? So this is her before, and then this is her after. As you can see, her face is more oval and round and smoother, and also even the skin quality has improved. Okay, and it's almost like 1 year been doing combination treatment. So I didn't do everything all at once, so it was just a period. But you can see much smoother, more feminine, and it looks very natural, right? Now, I've been asking to do her nose, but she said I'm reserving it for surgical rhinoplasty, so I can do thread rhinoplasty as well, but then she wants surgery, so I'm leaving it for now. All right, so this is her. Can we have a little bit of volume? Volume. Sound. Sound. Yeah, because the sound has an effect, you know. But you can see that she's still very feminine, and and she's actually recent. This Vogue cover of her was 2 weeks after Threadlift, and you can see she has. She said I had a slight swell in the cheeks, but it made my face even look better, right? So the next patient is Bonita. So she's a 30-year-old trans female. She's a celebrity fashion designer. She's very curvy, but she's very daring. Like sometimes I can see her post on Instagram, I woke up like this, with almost nothing, but it's still very decent and she's very beautiful. She's had past injections of fillers on her nose, her forehead, and chin, because also trans patients are on hormones, and that's why they're very prone with acne breakouts, no? So this was her when I first met her, almost 2 years ago, I think. So you can see, even from here, you can see that there's a little bit of over projection in certain areas, right? But anyway, my treatment strategy for her, these are the things that I did: regular facials, and also acne treatments, toxin, of course, to make her face smaller and snatched. And then I was doing filler for the nasolabial and jawline to make things smoother, and of course nose threads and thread lift. But before I needed to do all of the other procedures, I needed to melt these, right? Because they're over projected, they don't look good. And me, that's always my rule. If you want me to fix your face, want me to work on your face, you let me fix the issues first, right? And this is her 2-year journey with these combination treatment. You can see here before, throughout time from 2023. Also, not just 2 years, but 3 years, 2024 and then 2025. So much better. Her face is more harmonious. Acne, we've really solved it very well. I melted the fillers on the nose and then replaced it with nose threads. Because threads the problem, as you can see, she's had filler and it's widening. With threads, you don't get that widening, right? And then I refilled the forehead, but in a more smoother manner. Now, these are the side photos, as you can see, and even the jawline is really nice as well. Now, the reason why then in this last photo, I feel like she needs a bit more volume in the mid face. So, but because I'm worried about putting filler, I said, well, let's just lift it and reposition the tissue. She does have a little bit of very mild jowl. It's not really bad, but you can see a little bit the downturning of the lips. So I did thread lift on her. So I used this multi-directional barb thread. Now, what I did is I used 3 threads in the mid and lower face and then 2 by the neck. So I'm inserting the thread in the subcutaneous plane, okay? I'm doing hypercorrection and reinserting. This is a 19-centimeter thread, so I'm able to multiply every thread, so almost times 2, because I'm going to go all the way. So I'm targeting the jowls, the corners of the lips, as well as the ala, to create that nice lift in mid-face, do some hypercorrection, and then reinsert the thread for fixation, plus an extra vector. So even though I'm inserting 3 threads on the face, imagine times 2 is like 6 arms of the thread are all creating that vector and force upwards, right? But notice how I'm constantly doing hypercorrection. I'm not letting go of the tissue. So you can see that instant lift. Now, I also want to tighten the neck because, I love jawlines. So because one box of this product has 10 threads. So I'm entering by the platysma auricular ligament, where you could get really nice fixation. Okay, do some hypercorrection and then reinsert. So she's relatively young, so I don't really need a lot of threads per area, okay? So, and you would normally also see a little bit of dimple here, but usually resolves easily because it can be hidden by the hair. It doesn't really bother them. This was her 2 weeks after the threads. As you can see, she'd healed very well. A more V-shaped face, better definition of the jawline, and also better projection of the cheeks. And she's really very happy with it. You have volume, right? So you can see this was, actually this was 1 week after the thread lift. She was on the beach already, and she's very confident about it. And this is a video, so it's how it is. So she had a little bit of dimple here, so what she does is to cover it with her hair some. Yeah. Yeah. But it's really nice. It looks very natural as well. Anyway, in conclusion, trans patients are a delicate group of patients with specific needs. You need to correct cosmetic issues from the past procedures if present and if it's doable non-surgically. Combine injectable treatments such as toxins, fillers, and threads. Thread lift is a good alternative to fillers as it can provide a more natural augmentation and lift without overfilling. And finally, I always say this, let's not do a cookie cutter treatment for all our patients. Oh, feminized, so we're gonna do this. No, you have to listen to them. As you can see, I did 2 different styles for these 2 different transgender patients because every patient would have different needs. So you listen to them and learn to this ever-changing environment. All right, and of course, be a part of their journey. Anyway, before I end, I would like to invite you to Injectors Academy in the Philippines if you want to learn more on how to create natural results with injectables and combining them. Then please do follow me and watch out for our schedules. This was in IMCAS Paris where I proposed to my partner in just this year. And that's why IMCAS has always been special to us because we've grown together here in IMCAS. So anyway, thank you so much for listening. Happy Pride, everyone.
Thank you, Dr. Cyril, for the excellent presentation. And please, sit down, please. Any question?
If not, then yeah, please.
Yeah. No, I like the cross-hatching when I say because sometimes I do it. Although, one question, because like I and even Paulina, you can also answer. I don't like doing an entry point a bit higher because of the vessels, and I don't like any like bad bruising. But how do you avoid that, and have you encountered any problems with that?
Yeah, well, actually, like before this, if I use like conventional like big threads, I usually goes for like a lower entry points. Yes, but because this thread is like very small, so I mean like I never really experienced any kind of like hematoma from this threads, and maybe because I'm inserting on the superficial layer, on the subcutaneous layer, we know that the superficial temporal artery actually runs just above the superficial temporal fascia. So I try to like pinch the tissue up just to make sure I hold the subcutaneous tissue in my hand, and I try to go along into the superficial subcutaneous tissue. Yes, I use cannula, yes.
Yeah. Thank you. And my question, so using this kind of thread, this kind of cross position, do you really need still filler, or you reduced your use of filler?
I use less of filler, of course, because right now the overfilling syndrome is kind of like a big deal in the society, and people use less and less of the HA filler. And I think thread lifting is a repositioning kind of methods. So you get more volume, just like what Cyril said. Like you remove the volume from the lower face and then you put the volume into the mid face. So it's like augmentation, but without adding any additional volume or substance into the facial tissue. So that's why it's reduced the risk of the overfilling syndrome.
I would like to add up a little of the surface anatomy of the area here. Since I saw Dr. Rosalind, she drew the line from the upper earlobe to the lateral of the eyebrow. And the entry point is up to the most. So here is still quite a surface area because the superior temporal artery will go a little bit posterior, and from that on it will go out into the frontal area. So as long as we insert the thread, the longer we suppose that should be a more holding power or any like a fixation points to hold the tissue or the lifting effect longer. But I do agree that we have to beware of these minute branches of the superior temporal artery and vein here. Yes.
But I guess. I guess as well, in addition to that, the good thing with threads is you're not going to get vascular occlusion. Because I know they do they do filler there so that they get lifting, right? Like the ponytail lift, but at least this one, I mean, you get the hematoma, your patients will hate you for maybe 1 or 2 weeks, but you don't get any vascular occlusion.
Exactly, and I used to hold a workshop on thread lifting, not this one, like a conventional thread lifting. I would say I'm not afraid of hematoma because if you started to see the bleeding, just give it a good compression. That's it, like good compression, like firm and long enough, and then like you're gonna reduce the hematoma already. So I never really get hematoma. If I see bleeding, just stop it.
From the Syria for your technique. I love it because if you can use the thread, go back and have it as a fixation point, the V. So we can like a one thread, but you can have like a two direction. Even one, you can go a little more superficial, but on the other side, you can go a little bit deeper, like to fix it up. Quite a
Yes,
good
yes, that's
technique.
correct. Actually, the technique is really nice because there's a lot of area room for you to play around, right? And I know different trainers, different doctors, they have different techniques and style. But the thing is, like, especially if you guys are beginners with doing threads, I know there's a learning curve, as Dr. Roslyn has mentioned. It can be challenging in the beginning, but if you're able to learn the concepts properly and the techniques properly, I just hear the voices of my mentors in my head,
Yeah.
like Dr. George's voice in my head. You know, it guides me in doing it correctly. And over time, as you keep on doing it and doing it, you get better results. Like in the Philippines, actually, just to let you know, thread lift is still popular because, well, aside of me promoting it, but because if it's done properly, it really has really nice results. So you just have to unlock that.
Yeah,
That
unlock
you-
a little bit also the fear of the patient. Sometimes I work in Europe, so it means we have very conservative patients. They don't want to appear different. They don't want to have a long downtime. So sometimes, particularly in the beginning, at the beginning of the thread history, the techniques were a little bit aggressive. And probably this marked the patient's impression, and this is an obstacle we have right now. But once they overcome this fear and they understand that techniques changed, the composition of threads changed, the introduction of the thread with HA incorporated created much better healing period. So we have shorter downtime, we have less swelling, and the patients are happier. And just in a couple of hours, I will present another case of these new threads. When you see the patient the day after, 2 days after, and she's perfect. And this new experience, of course, is very helpful for us and make more patients coming and asking for threads. In this slide, I would like to ask you, Dr. Seeler, about you, of course, treat a lot of transgender patients, but also patients of the same gender. So which is the difference, in your opinion, in treating in vector position, in thread configuration, when you treat different types of these kind of patients?
Yeah, I mean, well, of course you have gender considerations, right? So, and I mentioned earlier that you can potentially widen a patient's face. For most men who want more male muscular gender expressions, then that's good because you're gonna improve the jawline, create some angle of the jaw if you do placement behind that. But also with age, it depends. So especially for those with heavy jowls, starting late 40s, 50s, and above, then you want more higher vectors, right? Doing one entry point sometimes as well can feminize the face if you have male patients. So you just have to consider that also. Even for me, when I started doing thread lift, I was just doing one entry point for everyone. And then as I see the effect, you're seeing that, oh, if I do it this way, then you start to modify it, right? Playing around with the entry points and the vectors and the direction or the number of threads per area, then you're able to modify depending on the patient's gender, depending on the patient's age, the shape of the face, as well as their gender expression.
Yeah. So you're practically saying that we can sculpture the face of our patients following the patient's request and their anatomy. So we don't need filler in order to sculpt and move the volume. We can create volume, but we can sculpt the patient page.
The filler I use after thread lift more of as a finishing touch. You know, like okay, I lifted it, there's a little bit of nasolabial line still, I'm just gonna put very soft volume. I lifted it, but I need some jawline, so I'm gonna use a very thin layer of filler. So then, like Rosalind said, you will tend to use less of the filler.
Yeah, we have the questions from the floor, please. You can say your name, your countries, and please.
Okay, Sawadee Krap. I am Dr. Raihan from Indonesia. I would like to ask two questions. First for Dr. Rosalind. Some patients develop Indian lines and too big malar apple cheek, and many Indonesian women do not like that. So how to avoid that? Maybe the entry points or how to insert the thread, your technique maybe. And the second question is, when I met many Korean speakers, they love to use a reverse technique. Question for Dr. Cyril. Which one is better between the reverse floating technique and the conventional one? Thank you.
Okay, so that's a really good question because I also experienced this kind of problem. We are all like Southeast Asian, so we have like quite a prominent of the malar area. So if your first thing first, thread lifting is not for every patient. For me, patient selection is very crucial. Some patients, they're just not there for thread lifting. You're gonna need to use other procedures. First thing first, patient selection. And yes, if you have the patient with quite a big of a malar prominent, you can actually twist it, the entry point a little bit, and also the vectors. Try not to go too horizontal because it's just gonna widening the zygomatic arch. I try to go more of the vertical kind of lifting and also try to avoid like right on the zygoma, maybe a little bit lower. Some patient, they have like a big malar, big zygoma, and they have like a subzygoma depression. So I try to imagine thread lifting is manipulating with the volume that's already there. So I try to move the fat here to fill up the area that was needed. So the design is pretty much different in each patient, but according to my lecture, the crisscross technique, you don't need that much of a lifting. It's more like a tightening, like put a cement on your face and make it tight, for instance, like sculpture or something like that. So with this technique, I don't really have to worry that much that even though my patient have a large zygoma, I'm gonna enhance her zygoma even more.
Reverse technique.
Reverse technique with
Okay. So actually, I also want to answer the question about the Indian line. So the mid-cheek groove or the Indian line. So when you see a patient, they usually would, even before the treatment, they already have that. But although I do try to explain to them that sometimes I find it attractive having that. But anyway, I understand some patients, they don't want that. So because when you insert the thread and lift the cheeks, you can potentially intensify or make that Indian line deeper. Now with threads, what we usually do, especially in the mid-cheek because the fat is thick, when you insert the thread on the deeper portions of that fat layer, it's still subcutaneous, but on the deeper parts, you can potentially get more volume upwards. All right? So that's one way of avoiding to make that deeper. Now, if they follow up, let's say after 2 weeks or after a month, and the line is there, I would use a very soft filler superficially just to cover and smoothen it and soften it. And just explain to them, you already have this line before, it's almost the same. Now, we're just gonna perfect it like the finishing touches. Now, in terms of the reverse technique, I think those kinds of differences in terms of technique would depend on the design of the thread and the configuration of the technique, because the technique is based on the design. Right? Now, for the threads that I use, we don't do a reverse because we want the fixation to be there superiorly. All right? Now, if they do a reverse and then they are able to fixate upwards, that's fine. I wouldn't be able to speak that. But the considerations that you would see, whether it's better or superior, it's not really just the direction, but it's more of, number one, the quality of the thread, okay, the technique, how the placement of the thread. But then again, it would also depend on your own personal experience, because I know you can teach one technique and every doctor would have, oh, it's not effective for me. Maybe because your style doesn't match the technique, All right, so those are the considerations.
So, still we have a question knowledge going on. In the afternoon, we will have one more session. So I need to close the session by now. Thank you so much for all our speaker friend. Thank you.